Very much, Mr. Chairman. Hello, Madam Secretary. Good to see you, and congratulations. I look forward to working with you. Just say how delighted I am that you're there in this very, very critical position. I want to follow up on Congressman Jesse Jackson's point, first of all, with regard to health care disparities. As chair of the Congressional Black Caucus, along with, of course, Congressman Mike Honda as chair of the Asian Pacific American Caucus, and Congresswoman Nydia Velazquez, who chairs the Hispanic Caucus, we are working on a health care disparities bill, closing the disparities. And you know the problems, you've acknowledged it, but I'm wondering, in this overall health care debate now that's taking place, we don't hear much in the debate about this being a critical element of the health care reform package, whatever package we come out. So I wanted to raise that with you because I've raised this with the White House several times, and just know that, you know, in this debate, this has got to be front and center for many of us because our communities, of course, are the ones who are, you know, the unfortunate, you know, beneficiaries of the terrible beneficiaries of these disparities. Secondly, with regard to single payer, I know the realities of single payer as it relates to what ultimately will be the type of health care package that we come up with, but I hope that single payer is on the table for discussion. I don't think we need a health care reform debate without looking at all of the options that exist, and so single payer is an option that needs to be considered on the table as part of our efforts. Thirdly, I just want to commend you and the President for your proposing to end the ineffective and discredited abstinence-only education programs. For many years now, Senator Lautenberg and myself have worked on legislation. It's H.R. 1551, the Responsible Education About Life Act, that allows for states, it's very simple, that allows for states to use federal money if they want to teach comprehensive sex education. It's abstinence and abstinence plus. So I hope that you will look at that, but I want to commend you and the President for that. Finally, let me just say I want to, on behalf of Congresswoman Roybal Allard, who comes from California, Southern California, I'm Northern California, she was detained in her district until this morning. Unfortunately, she couldn't be back in time, but she wanted you to know that she'd be submitting questions for the record and to extend her welcome to you, Madam Secretary.
Thank you so much. I definitely think as the the health reform debate and discussion is firmly here at the Capitol, underway in both the House and the Senate, 3 committees in the House and 2 committees in the Senate, and lots of you have been intimately involved. Whether it's single payer or health disparities, that information that you have the expertise about and the data that you know so well needs to be part of the discussion as the bills move forward. And I think that's not only very appropriate but very important that the options be looked at. As you know, the President laid out some principles that he believed in with health care moving forward, and he did feel very strongly that we needed to start with the premise that we build on the current system and not dismantle the employer-based health coverage. But I know there are a number of strong advocates for the single-payer system, particularly here in the House, and that I assume that will be part of the options that you look at as you move along.
Thank you, Madam Secretary. I have a little more time, Mr. Chairman. Let me just ask you, I'll make a point with regard to that, though. Yes, we are going to make sure that here in the House that is laid on the table, and that's included as part of the debate, single payer and health care disparities. But I would hope that we hear from the administration the importance of not letting that slide, because sometimes, we follow in many ways what the administration is laying out in terms of the general parameters. Finally, the HIV/AIDS travel ban. I know HHS sent over a proposed rule, but it's taken a long time. Do you have an idea of when we're going to be able to finally lift the ban as it relates to HIV-positive people coming into the United States?
My understanding is that's very much on the radar screen, and it should be soon.
Okay. Thank you very much, Madam Secretary. Thank you, Mr. Chairman.
Thank you, Mr. Chairman. And Madam Secretary, it's great to have you here. And I just want to quickly associate